join us today. Excellency Kastunobu Kato, Honorable Health Minister, Japan's G7 Presidency, Dr. Tedros, Director General, World Health Organization, Sri S.P. Singh Baghel, and Dr. Bharti Praveen Pawar, my colleague Union Minister of State, Health and Family Welfare, Sri Abhay Thakur, India G20 Presidency, South Sherpa, Sri Love Agrawal, G20 Health Focal Point, Honorable Ministers of Troika from Indonesia and Brazil, Honorable Minister of G20 and invited countries, distinguished delegates. Namaste. It is my utmost honor to warmly welcome you all to my home state of Gujarat. The city of Gandhinagar commemorates the lasting memory of Father of Nation Mahatma Gandhi and the value of ahimsa means non-violence, satya, truth, and sarvodaya, universal upliftment. His teaching of voluntary cooperation, dignified and peaceful coexistence has not only inspired our Indian Constitution but also driven our endeavors in G20 to collectively build one earth, one family, and one future. Excellencies, having witnessed one in a century crisis of COVID-19, we are G20 have a duty to prevent, prepare, and respond effectively to any such future crisis. Towards this, India prioritized health emergency prevention, preparedness, and response, placing emphasis on the One Health approach, recognizing that the well-being of our communities depends on the harmonious balance in the ecosystem. We have collectively agreed on a need for an end-to-end medical countermeasures coordination mechanism to timely deliver safe, quality, affordable, and effective vaccines, therapeutics, and diagnostic. Excellencies, equitable access to vaccine, therapeutics, and diagnostic should be a non-negotiable right of every individual. Joint vision of G7 and G20 on medical countermeasures is a remarkable convergence, and we as G20 continue to align with WHO process of working group on international health regulation and intergovernmental negotiating body. It remains my utmost hope that G20 can eventually facilitate the creation of permanent mechanism. Excellency, COVID-19 saw as a pivotal catalyst for greater adoption of digital health in empowering patients. The fragmentation and limited intersectoral collaboration limit its potential presently. The presidency has worked closely with WHO to establish the Global Initiative on Digital Health, WHO managed network. I thank all G20 members for their leadership in designing the initiative. I acknowledge the support and contributions of the Asian Development Bank, Vadwani AI, PATH, FIND, SEPI, Gates Foundation, SAFE, Foundation Bostnar, and other to GIDH. I urge all to consider aligning to the vision of GIDH and look forward to your commitment to the agenda. Also, I am delighted to state that our negotiators have completed negotiations on the text on the health ministerial outcome document and have successfully concluded the discussion on all subjects bearing one geopolitical paragraphs on Ukraine. I congratulate our negotiating teams. They have burnt the midnight of 4 weeks and have reached an agreement of critical global health matters after many rounds of in-depth discussion. The text of the final health ministerial outcome document has been shared with all of you today. So, with the concurrence and support of all of you, I now have the pleasure of declaring its finalization and adoption by all of us. It will be released formally to the media tomorrow. I once again thank you for your goodwill and constant support in ensuring that this collective endeavor of ours has been concluded successfully. I look forward to an effective follow-up of our agreed outcome document and its implementation in the months and years ahead. Excellencies, the challenges we face may seem diverse and different, but they stem from similar fault lines. I would like to begin today with a thought by Gandhiji. The future depends on what we do in the present. Let us seize this moment today, unite in purpose, and resolve to create a healthier future for all. Thank you. Thank you very much.